Hello, I'm Joel Barthelemy. More than 50 years ago, Congress passed the Community Mental Health Act. The legislation was part of then President John F. Kennedy's New Frontier. The purpose of the act was to build mental health centers for outpatient treatment that would replace institutionalization. Patients could be treated at centers while working and living at home. But only half of the proposed centers were ever built, and none of them were properly funded. And Congress did not provide enough money to operate them for the long term. Meanwhile, states saw an opportunity after the law passed to close expensive state mental hospitals. As a result, 90% of the state hospital beds no longer exist. On a single night in 2013, the U.S. Department of Housing and Urban Development said there were more than 600,000 homeless. An estimated 35% lived in unsheltered locations. It's not surprising then that many, if not most of the people we see living on the streets have serious medical and mental health problems. A 2009 study shows that providing health care to a chronically unhoused person is more than twice as expensive as the health care for people with homes. The study published in the Journal of American Medical Association found that chronically homeless individuals with severe alcohol problems often have multiple medical and psychiatric problems and use costly health and criminal justice services at very high rates. Once they are in housing, the number of daily drinks and the number of days drinking to intoxication declined. It may sound harsh, but we need to have an honest discussion. The chronically homeless often acquire and actually are transmitters of certain communicable diseases. Their nomadic nature makes it very difficult to maintain patient health information. Without basic health care, however, they may get sicker and even more desperate. 3 years ago, Carondelet Health Network in Tucson, the largest faith-based health network in southern Arizona, converted a donated large recreational vehicle into what they named the Van of Hope. It began making a circuit of shelters and charity dining rooms in that city where the homeless tend to congregate. A nurse practitioner provides health checkups, and patients can see behavioral health providers via Connected Care. Employees of the Carondelet Hospital facilities in Tucson volunteer and donate time to the Van of Hope as a service to their community. I want to commend this effort and those of other faith-based organizations who help the often invisible members of our society, whether it's through soup kitchens, a safe place to sleep, or help in finding jobs. Connected Care can provide access to health care, even for those living on the street. And this concept needs to be replicated in other areas. If you know of a successful program of Connected Health for the homeless, please send me the information. I would love to pay tribute to those as well. My email address is joelsblog@globalmed.com. You'll find it on this webpage. I'm Joel Barthelemy.